Welcome back. The next machine we are going to learn is the microdermabrasion, also known as MDA, or a skin polishing machine. Now this is a very safe and non-invasive approach for exfoliating the skin layer. So you remove at least one or two layers of this dead skin by abrading the surface of the skin. Now the layers you exfoliate depends on the intensity of the treatment. Now this machine works on a principle which has a handpiece which has a suction vacuum handpiece. So the intensity of the vacuum controls the efficiency or the intensity of the treatment. Now this machine has 3 hand pieces. The newer version has 3 to 4 hand pieces, where there's an handpiece which blasts off aluminum oxide crystals. There is another handpiece with diamond crystals, and the third is the Hydra facial treatments. So the handpiece which blast aluminum oxide, these are microfine crystals that is blasted over the skin, and they pass over the skin while you move the handpiece, and the suction or the vacuum sucks away the aluminum oxide along with the dead skin. The intensity of this procedure is adjusted with the vacuum setting. You can increase the vacuum or decrease by moving the knob on the machine. Also, you can regulate the blasting of the aluminum oxide crystals over the skin with another knob. Now this is a recurrent charge for us, where we have to refill aluminum oxide crystals after every patient, because the waste which is collected also has the dead skin along with the bacteria of the patient which you have already done. So you have to discard that aluminum oxide and refill it for the next patient. The next handpiece is with the diamond crystals. Those dentists here will understand. Diamond crystals are efficient enough and has the capacity to abrade a tooth. So how easily it can abrade a skin? Again, the vacuum controls the intensity of the treatment. You need not apply much pressure while using this probe, because it has very sharp abrasive. Diamond abrasive will abrade the skin. There are chances of causing ecchymosis on the skin layer if you use too much of pressure, and that mostly occurs in sensitive patients or those who are undergoing the treatment for the first time. These two handpieces are mostly used on oily type of skin. The third, Hydra facial, we can use it on dry type, because the first two handpieces tend to make the skin drier. Hydra tip will moisturize and hydrate the skin along with peeling of the layer. So in Hydra tip, as you have similar to the aluminum oxide tip, where aluminum oxide is blasted on the skin, here we have water filled in those dispensing glasses, and this water is sprayed on the skin and it hydrates the skin along with the peeling off. So this is more suitable for a dry skin. This procedure physically exfoliates the skin cells, and also stimulates the blood flow to the skin structures by stimulating fibroblasts. The suction will pull the blood vessels on the upper layers. It will give the skin a glow, and along with that it is also stimulating the fibroblast, giving the skin a toned appearance. But this doesn't happen in one sitting. You have to give a multiple sessions to get the desired effects. So while starting, we have to do a combination of physical cleansing of the surface of the stratum corneum, which will increase the blood flow and stimulation of the basal layer. It is like when we are scraping the top layer of the stratum corneum, we are instigating a healing response caused by mild and controlled irritation or by stimulating the skin. There will be efficient keratinization of the epidermis that follows by the cells which are germinated at the basal layer and pushed towards the stratum corneum, resulting in a more uniform texture and lucid appearance of the skin, causing lesser pigmentation to appear. The removal of excessive buildup of pigments on the skin is reduced, and you get a more uniform production of melanocytes, resulting in the correcting of uneven pigmentation. Also, the old sebum, which is clogged down below in the form of blackheads or whiteheads or even in mild acne forms, that is removed, and the entrance of the pore is opened. There is also balancing of the sebum production because you're scraping off the stratum corneum, you're removing the topmost layer, hence you're opening the pores, so you're releasing the old sebum and also regulating and balancing the sebum production, so the chances of whiteheads and blackheads and also mild form of acne is reduced. Stimulation of the collagen and elastin fibers because of the mild irritation, giving it a firm and toned appearance to the skin, and also softening of the fine lines. When you abrade the stratum corneum, you are removing the dead cells that is layered on it. So dead cells will be rough to touch, and the regeneration capacity has decreased, so there is appearance of fine lines or wrinkles. Once you start with this procedure, newer cells are formed, there is increase in fibroblast, therefore there is less amount of wrinkles and smoother skin. This treatment is not to be done aggressively in one sitting, but it has to be done in a progressive and controlled manner. If a patient comes in the first go, you don't have to abrade the whole skin and send him, but do it in a subtle manner and in a progressive manner. Optimum results are seen through a series of treatment that is done at regular intervals. So after 21 days gap, you call the patient for the next sitting, get a regular sittings done to get the desired results. Because also the treatment needs a recovery time, and this treatment is safe for all skin types, even for the type 4 and 5. This is much more safer than aggressive peels and laser resurfacing also. This treatment is also called as lunchtime peel because it is finished off within 10-15 minutes. It is very easy and is suitable for all skin types. It causes the skin to rejuvenate when the treatment is done in a proper manner. So the number of passes will decide how much layer of the skin you remove. So one pass might remove one layer, another pass might remove another layer. So when there is more pigmentation, you can give up to 2 to 3 passes, but more aggressive might cause wound there. Let us see what is contraindications and the indications from a microdermabrasion. Mostly, as I said, it is suitable for all skin type, but you have to go through the indications also. Choose your client well. See that what the client is expecting. You can choose clients who are looking for an overall rejuvenation of the skin, who wants a bit of tauntness. This has a lower cost compared to IPL skin rejuvenation or any other laser rejuvenation and even surgery, though the results are very subtle. There is at all no recovery time, or you can say very minimal recovery time. You can apply makeup soon even after the treatment, but see that you first apply a sunscreen. What all three conditions you can treat with this? You can treat sun-induced pigmentation, you can reduce melasma to some extent, age spots are reduced, you can treat blackhead, melia and congested skins and mild acne. Fine lines and minor wrinkles are reduced. Blemishes, flaking and dry skin. Large pores are shrunk. Ingrown hairs, mostly in men beard, are removed by this process. Excessive oiliness is reduced by sebum, controlling sebum production. There is a reduction in scar and stretch marks. There is blending of lines after laser resurfacing or plastic surgery. So you can use microdermabrasion for a larger scope, larger variety of patients. This one microdermabrasion treatment might remove as much as 30% of glycolic peels, 3 session or a 1 session of 70% glycolic peel treatment. So this can be that effective. This treatment does not produce any heat, so there are no chances of burn, and there is very less risk involved, even in for choosing a medically compromised patient also. If there is a tanning, so wait for 2-3 weeks before you're peeling the skin with MDA. Even in the eye area can be treated safely. Just you have to see that you're not applying more pressure. You can treat for puffiness, dark circles or fine lines that appear around the eye. It also reduces the melia that is formed mostly around the eye. Those who have not been going under scrubbing or any treatment, you will see minor granules below the eye. These are the melia. People with epilepsy, metal pins, pacemakers can be treated. As I told, there is very less risk even while treating medically compromised patients, where often they are contraindicated for majority of electrical and light treatments. It is tolerable and for some people very comfortable treatment. There is no anesthesia also required. You can immediately go off to work. There is no you don't have to protect your skin for a week or so. Of course, sun protection is mandatory. Whom you should not do the treatment? Of course, very sensibly, you should not do it on severe acne where there is a chances of spreading the bacteria. In cases of psoriasis, where there is vascular lesions, where there are chances of bleeding if you rupture them. Rosacea, dermatitis, there's an infection of the skin, or eczema, where there is uncontrolled diabetes. There are warts, herpes or cold sores, where there is immunodeficiency diseases like AIDS or hepatitis ABC. There is a skin cancer, with his heavily pigmented tattoos, that is not going to be reduced by MDA machine. Relative contraindication is high blood pressure, heart diseases, and systemic lupus. Mostly these are all problems or diseases related to skin and vascular lesions. People who are using the following medications are also contraindicated, that is roaccunate in last 6 months, or blood thinners including aspirin and steroids. Blood thinners like aspirin, then steroids. Also facial fillers done in last 2 weeks, because there are chances that the fillers will resorb or dissolve sooner if you do with this treatment. Fillers need at least 4 weeks to settle down. So there should not be any treatment done after fillers.